I'm a recovered alcoholic, so I haven't had a drink for coming up 12 years now. And Lola is coming up 14, so that will give you an idea of what was going on. For many years I was worried about, does she have Fasd? I'd look for indicators, but I never knew for sure. And then things changed for Lola pretty rapidly when she hit high school, and I took her to a paediatrician, and that paediatrician let us know about the clinic. And I thought, okay, it's time to take it out of the dark and into the sunlight. I can't be alone with this. And so I brought Lola in, and she went through everything, and we got a diagnosis. And from then, things have really looked up.
Fetal alcohol spectrum disorder, or we call it Fasd for short, is a neurodevelopmental condition, and it happens because of alcohol use during pregnancy. The way that we think about Fasd is that it really is a full body condition. So at UQ we've been doing lots of research to really understand what are some of the impacts that the alcohol has, and we've found lots of things that people may have not known before, and that's some of the things around the impacts that the alcohol can have on the developing all the body really, all the organs and systems of the body.
The amount of times I thought I was just this dumb kid who didn't understand how to fit into a certain society, like I'm a kid who can't, just be like any other child. And I think that's obviously the other kids in that school didn't understand, so they just picked and poked and made fun of me and said, oh, you're not a functioning member of the school. Same with the teachers, they said, well, why can't you do this? It's that easy, or why can't you just do it? I don't know. I can't do it. And now that I'm here, there's an answer to why I can't. And that's just like a relief. It's, just how I am now, and it's just how I have to live at this moment. And I'm actually a lot happier now in a different school with now an understanding mother of the perfectly safe environment. It's a lot better now than it was last year. So certainly the clinic has helped so much.
In a partnership with Children's Health Queensland, we've started a clinic here that provides assessment and diagnosis and support for children who have Fasd and their families. And so the young people or the children, we see people up to 17 years of age will come in with their parent or their carer, and we'll do a whole bunch of different assessments with them to help understand what are the things that they can do well, and what are some of the areas that are a bit tricky for them.
Well, when we bring kids in to do our assessments, we're also really interested in what other problems they might be having. So we know that many things that occur during pregnancy, things like maternal stress or a poor maternal diet, these can lead to young people being at increased risk of things like hypertension or diabetes when they get older. So we've started to think about, can our young people with Fasd also be at risk of these diseases? And the thing is, if we can identify them early, we can actually put things in place that might actually prevent the onset of these diseases.
For a lot of our families that we see, they may have been going through a long time wondering what was happening for their child. They may have been to see lots of different specialists or lots of different health professionals, and they've never really gotten the full answer. So for us, a lot of the time we hear that, we've been to lots of different people, but we don't really know what's going on. And that's because there's a lot of misconceptions about Fasd, and there's still a lack of services in our community. Because we are set up here as a student clinic, so we have no funding to provide this service, and the way that we do it is through a student and professional model. So we work together with our students and we teach them how to do the assessments, and then our students provide the assessments with support from our clinical staff. So that's how we're able to get some assessments done. But without any funding, we can't expand our service, and we can't provide, all the assessments that are needed. So we do have really extensive waiting times. At the moment, it upsets me to say that it's probably around 2 years to get into our clinic. So yeah, it's really hard for families.
I would say to parents who are worried, adoptive or biological, don't hesitate. Don't hesitate. Once upon a time, things like ADHD and autism weren't discussed. Those children were hidden too. And today we wouldn't dream of such a thing. So I would say let's stop hiding young people and children who are born with Fasd, and let's start bringing it into, let's start looking at it a different way. And to do that, we've got to take away the shame, and we've got to stand up and say, me too. Yeah, that, lives can be changed. I know ours certainly has. And come out of the darkness and into the light, and your life will change too, and so will the lives of your children.
Look, one of the things we're really passionate about is raising awareness about FASD, and we think that by the clinic being more visible, people understanding what we do will help raise that awareness and also reduce the stigma that exists around FASD. So what we really need to really make this clinic successful is always a little bit more funding. So if people out there sort of know and understand what we do and realise that any donations they make would be 100% given to the work that we're doing with these children and their families, we just encourage you to get online and just make a small donation that could make a really big difference to these children and their families.